milestone in global health cooperation. This second WHO Global Summit on Traditional Medicine will bring together scientists, innovators, and practitioners to chart a decade-long global roadmap for evidence-based, equitable, and sustainable use of traditional medicine. This year's theme you are all aware of, it has just been shared. It is restoring balance, the science and practice of health and well-being. It reflects both the urgency and it also shows us that an opportunity lies before us. This is not merely a continuation of the first summit which we had in January. It is an elevation of the dialogue from recognition to action. It demonstrates how India's leadership in WHO's global mandate coverage to make traditional medicine central to the pursuit of health for all and SDG 3. Bringing traditional medicine to the international stage is rooted in the vision of our Honorable Prime Minister, who recognized very early the enormous potential of traditional systems in funding the whole and person-centered healthcare. We remain deeply grateful to this leadership of his, which continues to inspire countries worldwide. Traditional medicine, including complementary, indigenous, and also ancestral practices, is a global reality. Billions of people rely on traditional medicine, often, very often, as the first, closest, and the only form of care. WHO data shows 170 out of 194 countries report its use. If we go to countries, we find that Germany and Ghana, the usage is almost 70%. And if we look at India and China, it is over 90%. For the 4.6 billion people who still lack access to essential, safe and effective traditional medicine is not optional. It is vital for achieving equity as well as universal health coverage. Recent WHO assessments also highlight the growing institutional commitment. 90 member states now have national traditional medicine policies, more than double the number that existed in 2005. Yet, only 57 countries have dedicated research institutes, underscoring the need for investment in scientific capacity. With most traditional medical practitioners operating in the private sector, only 13% of the countries offer these services in public health facilities. Strengthening integration and equity therefore remains a great priority. This help becomes even more sharper in the context of today's overlapping global health crisis, the rise of chronic non-communicable diseases, which we are all aware of and which lead to more mortality today than communicable diseases. We also find that mental health burdens are now growing. There are persistent inequities in access and contractions in global health financing. Traditional medicine also offers substantial, though often underutilized potential in addressing these very complex challenges. While the demand of traditional medicine is growing, we find that the evidence gap remains. Less than 1% of global health research funding goes to traditional medicine. WHO's role is very clear. It is to ensure that traditional medicine is safe, it is effective, and is integrated responsibly into health systems. We apply the same scientific standards to traditional medicine as we do to biomedicine through rigorous research. The Summit's program is ambitious, as we have just heard. It's a very packed program and it is future-oriented. Core focus areas include evidence and research for policy and practice, innovations in digital health and AI, biodiversity and sustainability, global standards and regulatory strengthening, and most importantly, equitable access and benefit sharing. Several transformative initiatives will be launched at this summit: the WHO Global Traditional Medicine Library, the Global Research Priorities Roadmap, guiding countries to close the evidence gaps, the Health Heritage Innovation Challenge, announcing 21 breakthrough solutions which have been selected from over 1,000 submissions, and commitments from governments and partners to advance the WHO Global Traditional Medicine Strategy, which covers 2025 to 2034. We will also announce key global instruments, including the inaugural meeting of the Strategic Technical Advisory Group, which we call STAG, the launch of the Traditional Medicine Data Network, and the draft WHO framework on indigenous knowledge, biodiversity, and health. The summit will emphasize, importantly, South-South collaboration. It will leverage the knowledge, the expertise, and the innovations of the Global South to advance research, technology, and mutual capacity building in traditional medicine. The summit will adopt the Delhi Declaration on Traditional Medicine 2025, establishing a 10-year implementation framework for research, for regulation, for access, with commitments from member states and partners. Traditional medicine is about more than health. Let us keep that in mind. It is about rights, it is about equity and sustainability.